What are some of the lessons that you have learned, you know, compared to 6 months ago, or 9 months ago now, about having cancer, and particularly the role of the physician on both sides of the bed here?
Well, I'm not going to say things I think that are very predictable here, actually. But the biggest thing, I think, from the point of view of a patient is the thing about caring. I spent my whole life trying to develop new cures for things. I never imagined that the most important thing as a patient is actually the actual act of caring. And that's something I really think that physicians and other healthcare providers know intuitively. They know it, but it's so huge to realize that you're not only being looked after by a world expert, but by someone who really cares. And to be very specific about that, I mean, literally a touch on the arm, a hug, a look straight in the eye, and someone saying, I care about you, is probably the most potent therapeutic thing there is. But the flip side to that, like with every therapies, is the opposite is also true. One of the most destructive things to a patient is the act of ignorance, if you can call it that, being ignored, the sense of being left in a corridor, nobody's talking to you, the sense of an accidental mistake being made because someone was given the wrong drug or, God forbid, the wrong surgery. So that's been the big thing for me. I would love to say I'd had huge insights about some new drug that I had thought of and so forth. But it's really what I call administrative toxicity on the one side that can get in the way. And on the other hand, the huge benefit of the vast majority of healthcare workers who do care and are able to communicate that. And I think maybe the last point I should make about that is caring has a huge amount to do in organizations with leadership. Organizations have to be led by people who care, not by economists, not by people who are bean counters, or counting how many surgeries have been done, or how many this, that, and the next have been removed. That's fundamental to an effective, I don't mean in a kind of California way, nice and effective, but effective in economic terms and in clinical terms. You absolutely have to have people at the top who care, and we're very lucky to have people like that here.
You know, I think that as an oncologist, and I think everyone that goes to medical school, no matter what their field is going to be, they're caring physicians. You know, we live well as physicians. We don't have to worry about getting shoes for our children. We're going to be able to feed our family. But I think oncology is unique. I think the relationship we have with patients is totally different than other subspecialties. And we don't just care for our patients, but we care about our patients. And I think the relationship we have with our patients is something that really is unique, and it's something that we don't see in other specialties. It's somewhat self-serving for an oncologist to say that, but I think we do have a different relationship.